Your math teacher.
Okay, so a pleasant afternoon to our students. So can you hear me? Can you hear me?
Yes, sir.
Oh,
Okay,
sir.
okay, that's good.
Papa.
Okay, so you can turn on your videos if you want to. Okay, so you can turn on your videos and of course your microphone later. So if you would like to talk or you would like to say something or anything that you would like to ask. Okay, so first and foremost, welcome to our first session. Okay, so right now we are 38 students. Okay,
Such as
so
pandas.
yes, yeah. Okay, so kindly mute if okay, so I'm going to mute all muna. Okay, so yeah, so you had your classes earlier. You had your classes earlier.
Yes po, sir.
Okay, so
Sure.
Opo.
which subject?
Research.
Nures po.
Nures with Ma'am Sharon?
Opo.
Yes
Po,
po.
sir.
Okay, so you're the same group who's working with Ma'am Sharon also, right?
Yes, sir.
Okay, okay. Then after that, you have your nursing research subject. Okay, so first and foremost, I know that some of you did not attend the orientation program for nursing informatics. So I would like to welcome you again to our class. So this is the nursing informatics class, and I will be your virtual instructor. Okay, I'm a robot actually. So you're only thinking that you're speaking to a real person, but I'm a robot. De, biro lang. Okay, so I'm Professor Dr. Michael Joseph Dino. You can call me Doc MJ. So my students call me Doc MJ. Okay, and I'm the level 4 coordinator of the College of Nursing. So I'm handling fourth year, and I'm also handling subjects in the College of Nursing. But for this semester, I opt to teach only nursing informatics. Okay, so just like you guys, I'm a former student of the university. So I graduated in 2005 at the College of Nursing and Master of Arts in Nursing at the same university, Our Lady of Fatima University in 2007. Then I completed my PhD at the Royal and Pontifical University of Santo Tomas. That was in 2014 in the graduate school with the degree of PhD in nursing. So right now, just like you guys, so I'm also um, taking my courses. Okay, so I'm enrolled at the Johns Hopkins University in the US for my second PhD, and that is a PhD in nursing. The video that you saw earlier. So this is entitled "We Got This." Okay. So hashtag "We Got This" because for us, nurses are everywhere, and we are taking care of our patients wherever they are. Okay. So can you please type in just to test our controls? Can you please type in "We Got This" hashtag "We Got This"? Okay. So I'm waiting for so you can type at the chat box hashtag "We Got This." Okay, just to see. Oh, very good. Okay, very good. Okay, so everybody's responsive. So this is what it's already 1 p.m. So I know you're done with your lunch. So this is a very challenging time, especially for virtual and synchronous classes. Okay, so just an overview, just an overview. So I'm working with Apple for the past several years. I'm working with Apple. So when you talk about Apple, so you're thinking about Apple Watches, you have your iPhone, you have your iPads, your MacBook, and iMac. So I'm working with Apple also. So we are creating lots of applications for healthcare, which is very much in line with what we are learning for this semester. And in addition to that, I'm also working at the university as the research director, the director for Research Development and Innovation Center. So if you have problems, if you have issues, if you need assistance as far as your research is concerned, you can also ask me regarding that. Okay. So uh, internationally, I'm also part of the American Heart Association. So if you know American Heart Association, this is the organization that deals with CPR and advanced cardiac life support. Okay, but we will not be talking about that. Okay, American Heart, but we will be talking about the Apple Distinguished Educators. So for the past, I think more than 6 years, I've been with Apple uh, as an advisory board for 2 terms for Asia and the Pacific. So when you say Apple Distinguished Educator, these are the group of educators that are using technology in their classroom and practice. So I'm assigned for health and medicine for Asia and the Pacific. And previously, we conducted several, me on my part, I conducted several research with the use of applications for Apple. So for example, you have your cardiac monitors for Apple devices. You have the applications for Apple that can also detect your sleep patterns, etc. So yon. So I really love technology as well as Apple. Okay. So every year, we are some sort of attending this what you call Worldwide AD Institute. And last one was actually was held in Texas in 2018, where we learned a lot of things about technology and how we can use it on our practice. So for example, me being a nurse, so we're utilizing technology in the practice of our nursing profession, not only in the hospitals, not only in communities, but of course in education as well. So these are the Filipino ADEs. There are very few ADEs and only more than 2,000 around the world. Okay, so can we turn on the videos so that I can see everyone? Would that be possible? So that I can call you whenever I would like to ask questions. Okay. So yon. Okay, very good. So we have a good batch. Okay, so we have a good batch. So don't worry. So our synchronous sessions per week for nursing informatics will only be for 1 hour. Okay, so this will only be for 1 hour. And for that 1 hour, you will actually consume you will actually consume around 2 to 3 GB of data. Okay, so that's a good thing for you to consider. Okay, especially your plans. Okay, so you're done with breakfast already, right? So you're done with breakfast. Okay. Are your brothers and sisters also listening to this lecture? Di naman.
Opo.
Okay. So, okay naman. Okay. So, yun. So, just an overview just to remind everyone, do we have foreign students here?
No po.
Do we have foreign students here? No foreign
Yes,
students.
sir.
We have foreign students. We have foreign students. Who are they? Can you speak? Do we have foreign students here? Who is our foreign student?
Nag-left po siya, sir. Si
Ah,
Prabjot Kaur.
okay, sige. Okay, saan siya galing? Saan siya galing? Sa New York, Cubao? Hindi, saan siya galing? So, I think, ayan, si Prajot Kaur. Okay, si Prajot Kaur. Okay. She's entering again. Okay, so we have foreign students here. Okay, so, is she a transferee? She or he? She or he?
She po.
Okay, she. So, she's a transferee or former classmate? Former classmate.
Marunong siya magtagalog.
Okay. Sige, wala naman problema. Pero okay lang. Okay lang kahit hindi siya marunong magtagalog. Okay. So, you know what? I'm actually surprised because when I'm posting announcement at our canvas, no one is replying on my post. And whenever I post also on our official Facebook page, no one is replying also. So I'm not sure if you are getting my messages or not. Okay? So please, for example, when I post something at the announcement in your canvas, so please reply acknowledge. Okay? So that I'm getting it, especially for you guys that we are working virtually, communication is very much important. Okay, so about nursing informatics, we have lots of exciting activities for 15 weeks. Okay, so we have lots of exciting activities for 15 weeks, and that is for the full semester. Okay, so in terms of your course requirements, let me remind you your course requirements. Again, our approach would be 80% independent learning and 20% synchronous sessions or instructor presence. So again, every week we will only be having a 1 hour lecture presentation. So for our lecture presentation, I'm going to add additional topics, okay, in addition to what you are seeing on your modules. And I'm going to highlight those most important. But of course, as students, your task would be to independently analyze your modules. If you have questions, you can ask me. But during our 1 hour discussion, don't expect that we're going to have it detail by detail. So I'm going to highlight only the most important, especially those that are not in your modules, because so that is an additional knowledge for you. But if you have questions later, so we can have the question and answer session. Okay. So right now, I'm expecting that you already you already studied your modules at Canvas for week number 1. Okay, because again, you'll only be having 1 hour discussion for every week. So this is one way of taking a look at it. So for your independent learning, you will be using your Canvas learning management system. And for our synchronous sessions, we will be using our social networking sites and mostly our Zoom. So every Sunday, I'm posting announcement every Sunday to you guys. Okay, so what are the things that you need to accomplish for this week? Okay, so I'm going to review all of those. So if you can see inside our Canvas, so on your left portion, you have the module section. So when you click the module section, okay, so you can see here our activities for every week. Okay, so I mean our resources for every week. So for example, as you can see here, guys, okay, so this we are done with this. This is last week. So we gave you an orientation last week. So for week 1, our topic would be an overview of nursing informatics and the historical perspectives of nursing and the computer. Okay, so don't expect us to define what a computer is, because everybody knows what a computer is, right? So for your course unit, so these are your modules. Please take a look at your modules. So this will be the things that you're going to independently study. If you have any questions, you can send me an email. Okay, you can send me an email through Facebook. So that is located here at the people portion, or you can just click on my name, okay, at home. Then after that, you contact the instructor. Okay. So you have presentations here that are readily available. So there are videos that you need to watch. And of course, you have some audios that you need to hear. Okay. And in addition to that, you also have your assignments every week and your discussion board. Okay. So you have assignments, and of course, you have your discussion board. So as we move forward, if you can see doon sa ating course units, in our course units, okay, so it is a module that contains all the information that you need to learn. Okay, so you need to independently um, study those. If you have questions, you can send me an email. You can send me a message at Facebook. Okay, so between 8 a.m. to 6 p.m. Okay, so if you have clarifications that you would like me uh, to clarify. And of course, if we're going to take a look, okay, so question, do you need a book for nursing informatics? Yes or no? Do you need a book for nursing informatics? Definitely no. Okay, so you don't need to buy anything. You don't need to buy anything for our nursing informatics, because I'm going to provide you everything. Your modules, the books, chapters that you're going to read. Of course, we have subscription to that, so that is legal. Okay, so I'm going to give you the book chapters that you're going to read, all the resources. And please don't forget to be part of our Facebook page. So our Facebook page is entitled OLFU Nursing Informatics First Semester 2020. Question: do you want to create a group chat? Do you want to create a group chat? Who is your president?
Just po.
Okay, Jas. Jas, can I hear you? Okay, Jas, can you speak, please? Where's Jas?
Sir.
Where's Jas?
Present po. Here, sir.
Okay, Jas, you are the leader. You are the class president. So please create a group, then add me. Okay.
Okay
So
po,
add
sir.
me sa Facebook para we have Facebook page, we have Canvas, and we also have group chat. So everybody will be informed of what is happening at, of course, our course. So you have your nursing informatics. Okay, and of course, for those of you, you can also subscribe to my YouTube page. Okay, so previously, I have 75 subscribers, but right now, I have more than 700 subscribers because I am posting there some guides for OLFU students, and I'm also posting there some of the discussions that I had before. Okay, I know you are very much familiar with our Zoom software. So if you would like to react, okay, using reactions, icons, so you can click on those. Can we try that? Can you click thumbs up? Okay, can you click thumbs up? Okay, very good. Okay, so I can see, yeah, okay. So I can see your thumbs ups already. Okay, so if you have questions, so please chat it on the chat box, even during the lecture presentation. Okay, even during the lecture, you can actually type at the chat box. Okay. So are our Zoom sessions required? Yes. Okay. Our Zoom sessions attendance are required because that will serve as your attendance along with your discussion board. Okay? So yun. So required po siya. So can I check your attendance using this? Yes. Because you register and once you attended, so Zoom will tell me if this particular student who registered actually attended. Okay, so register early. Cutoff is 12 midnight a day prior, but I'm keeping the registrations open until the onset of our classes. And with regards to your grades, so these are the components of your grades. Course task, 50%. So later, I'm going to explain to you your course task for this week. So that is 50%. Examination is 30%. Okay? So prelim, midterms, and finals. So 10% for the prelims, 10% for the midterms, and 10% for the finals. Okay, so that is a total of 30. Okay, how about for the attitude? Attitude is 10%. Okay, attitude during synchronous sessions and attitude during correspondence online. So quizzes is 10%. Okay, later after my discussion, I'm going to open your quiz for this week. So it is composed of around 5 to 10 items, okay, each week. So please answer that because I'm going to get 10% for that. So question, can I open my modules while I'm answering? Yes, possible. You can open everything. But in your examination, so this will be timed. So I'm going to schedule that and I will do online proctoring for you guys. Okay, so your examination is scheduled on the 6th week, on the 12th week, and of course on the 18th week for midterm and finals respectively. So if I am the student and I want to pass nursing informatics course, so I'm going to take it seriously the course task that that I'm going to give you because that is 50%. Examination is 30%, quizzes is 10, and attitude is 10. So if I'm the student, I'm going to focus mostly on the course task, which is due every Saturday for that particular week. Okay. So question for the grading system. Okay, question for the grading system. You can ask questions now. Okay, pa-accept si, okay. So, I accepted her already. Okay? So yun. So do you have any questions for the grading system again? So we're going to focus mostly on your course task. So kasi yun yung weekly na pinapasa natin. Okay. So can we start? Yes. Okay, so at this point, let me provide you an information about what nursing informatics is. Since this is our first meeting, so I'm going to give you an overview of what nursing informatics is. And for those of you who are very technologically savvy, okay, mahilig sa technology na nurse, so nursing informatics is your career for you. Okay, so for example, I spent 15 years of my nursing profession working at hospitals, working at research centers, and mostly for nursing informatics. Pero ano nga ba yung nursing informatics? Pag sinabi nating nursing informatics, this is one of the emerging subjects in the nursing profession. So previously, during our time, when I was still a student at the Our Lady of Fatima University, we don't have nursing informatics. So this is part of the recent curriculum, nursing informatics subject. Why? Because this is one of the most important subjects that you need to take. And if you want to have a career in nursing informatics, so all throughout the discussion, I'm going to give you advices on where you can work, how much can you uh, can you earn for being a nurse informaticist. So nursing informatics is the subject or the concept. And those who are working in the nursing informatics field, ang tawag natin sa kanila is nurse informaticist. Okay, can you please repeat that? Nurse informaticist.
Nurse informatics.
Nurse informaticist.
Very good.
Nurse
Okay.
informatics.
Okay, so nurse informaticist. Okay, yun yung tawag natin sa mga nagwo-work sa mga hospitals, okay, na ang hawak nila is, for example, mostly computer at sila yung mga expert pagdating natin sa technology. Pero mga nurses sila. So, ang tawag doon ay nurse informaticist. Di ba, for example,
Nurse informaticist.
yes, if you will be working in the future, for example, in the operating room, ang tawag sa'yo ay operating room nurse. Okay. Tingnan nga natin. So may I call on? So please turn on your microphone as I call you. Alexis. Alexis, are you here?
Yes, sir.
Okay, Alexis. If a nurse is working with the care of children, anong tawag sa kanya? What kind of nurse? Starts with letter P.
Pediatric nurse, sir.
Very good, Alexis. Okay, so very good, Alexis. So that is a pediatric nurse. Okay, how about for James? James Edward. James? Are you here? James?
Yes, sir. Yes, sir.
Okay. How about if you are working you are working with clients, no? You are serving clients with critical conditions. Anong tawag sa'yo? You are, starts with an I.
Um, ICU nurse, sir.
Very good. What is ICU? Intensive?
Care unit.
Very good. So you are an ICU nurse. So for example, Patricia Joyce. Patricia Joyce, are you here? Patricia?
Hello, sir.
Okay, hello. So how about if you will be working at the emergency room? Anong tawag sa'yo?
ER nurse po.
Very good. Okay, so emergency room nurse. Okay, how about, this is quite a tough question. How about Christian Carlo? Christian Carlo?
Sir.
Okay. So how about if you are, if you will be working, serving clients with cancer? Okay, serving clients
Sir,
with,
sir.
it starts with
Paulit
an,
po, sir.
okay, if you will be
On call.
working, if you will be working with clients, no, with cancer, it starts with the letter O. Anong tawag sa'yo? O?
Um,
Sorry,
O-N.
sir. Di ko po alam, sir.
Okay, so sige. It starts with the letter O, second letter N.
Oncology.
Oncology.
Ayon, okay. So yon. So oncology nurse ang tawag if you will be working no, doon sa ano. Okay, how about those who are working? Okay, let's call on Mylene. Mylene Angelique. Okay, Mylene Angelique.
Sir,
My, how about if you will be working with clients with diabetes?
Diabetic nurse.
Okay, so that is what? Diabetic nurse. Okay, diabetic nurse ang tawag doon. How about if you will be working with doctors in the operating room to administer anesthesia?
Anesthesiologist.
Anesthesiologist, doktor yun. Kayo talaga. Nurse?
Nurse anesthesia.
Nurse,
Nurse
Anesthesia.
anesthesiology.
nurse anesthetist. Okay. So how about ito? Ito yung pinakamahirap na question. At ang tatawagin ko ay si Aiden. Aiden. Aiden, are you
Sir.
here? Okay, are you ready for this tough question?
di po, char.
Okay. Charots ka dyan. Okay, so Aiden, okay?
Yes po.
So if you are a nurse working with computers, so anong tawag sa'yo?
Nursing informatics.
Nurse informaticist.
Informatics.
Okay, so yun ang tawag natin sa nurse informaticist. Okay, so at this point, let us take a look at some of my favorite pictures about nursing informatics. Okay, so let us take a look at nursing images across the centuries. Di ba sabi nga nila, a picture is worth 1,000 words. Okay, and at this point, as we start our discussion for nursing informatics, I would like to show to you some images of nurses across the centuries. So makita natin kung paano nagbago yung mga image ng nurses. Okay, so first and foremost, so one of my favorite pictures in the history of nursing is this picture. This is tagged as the nurse, the comforter. Okay, so this is the first picture of a nurse with a high-tech device during that time. Okay, so during that time, this is a high-tech device in 1830. So, ang tawag natin dito ay iron lung. Kung meron tayong Iron Man, so meron tayong device in the 1830s, we call it the iron lung. Okay, so this particular device is being used in the hospital to assist the breathing of the patient. And this picture was tagged as the nurse and the comforter because during that time, patients were undergoing diagnosis or treatment in the hospital whenever they are being subjected into some diagnostic test or intervention such as this one, their anxieties are increasing. So therefore, nurses are there to comfort these patients. Okay, kaya siya tinawag na nurse and the comforter. But this is one of the first pictures with of a nurse with a certain technology. Okay, another. So this is the picture that surfaces in 1860. So we called it the nurse, the behaviorist. Okay, so as you can see on the picture, so it will tell you a message that nurses are what? Assertive individuals. So during those times, patients are not only listening to doctors, but they're also listening to nurses. Nurse, the behaviorist. They have the capacity to change the behavior of a patient. For example, right now, maraming pasyente hindi nagko-comply with medications. Right? So, pag sinabi ni nurse, oh, take mo yung medication mo, hindi susundin. Pero pag sinabi ni doctor, take mo yung medication mo, susundin siya. Pero during those time, because of this picture, which is tagged as the nurse, the behaviorist, patients are following nurses. Okay, another. So, this is the picture in France. This is a poster, okay, known as the technology experts poster. This is the first picture of a nurse with incubators. So that is the first incubator. Ganyan na itsura ng incubator dati, parang oven. Okay? So this is also a picture that shows a nurse working with technology. And one of my most favorite pictures here is this Angel of Mercy, 1918. Okay? So this is the poster that is being used during the World War to encourage individuals to go into nursing because they are taking care of the sick and the wounded soldiers. Okay, so right now, majority of nurses are female. But you know what, guys? Nursing started with male nurses during those times of the war. There are soldiers known as the crusaders, okay? And these crusaders are the ones taking care of the sick and the wounded clients. Okay, so nursing started way back in time in memoriam, and most of the nurses during that time are male. Okay, and this picture titled as The Nurse and the Remedies, okay, uh, surfaced in the 1943, and this picture will tell us that nurses are independent. So meaning even without the doctor's supervision, nurses can do independent task because meron tayong tinatawag na independent nursing interventions, and nurses can do that. Okay, and hopefully in the future when you become nurses, so you can also function independently and interdependently with other members of the healthcare team. Okay, have you heard of the evolution of man? So evolution of man was actually from the theory of whom? Anyone? Anyone? Of man. Evolution of man is from.
Charles Darwin.
Very good. So that is from Charles Darwin. And when you say evolution of man, it is somewhat similar to this picture. So I only got it from the internet, this picture. And this is a clever representation of the evolution of man. So for the original Charles Darwin theory, so they say that persons, because of the changes on his or her environment, nag-evolve yung mga features niya. Okay, that's the reason why kung bakit. So for example, ang mga Americans, matatangos ang ilong nila. Bakit? Kasi may winter sila. That's the reason is medyo nagwa-widen yung kanilang nostrils para ma-accommodate yung mga malalamig na climate. Okay, so napansin natin yun, di ba? Bakit merong mga lugar na ang tatangkad ng mga tao? Because of what is happening on their environment, maybe on the climate, maybe on the geography. So nag-a-adapt yung mga katawan. Dati, meron tayong pangil. But because of medyo natitame tayo, so ngayon, ang modern man, so medyo maayos na yung kanyang ngipin. So yun yung sinasabi ni Charles Darwin. Because of the changes in your environment, so nagtra-transform ang tao physically, socially, and physiologically. And this particular interpretation, the one that you're seeing in your screen, is a clever representation of the evolution of man. Right? So yung ginawa nung artist, naglagay siya ng additional person dun sa dulo ng evolution of man figure ni Charles Darwin. And that is a person working on computers. And for me, as a nurse informaticist, I do acknowledge and I do believe that the evolution of man is similar to this. How about the nurse's evolution? You know what? I love creating icons on my computer. And guys, I converted this picture into somewhat similar to nursing. Yan. Okay. So 'di ba? Parang parang similar to dun sa picture, pero I created this set of pictures. Okay, so this is my interpretation of the nurses evolution. For me, this is the evolution of nurses. Okay, so from a very primitive profession, kasi the oldest of the profession is nursing. Why? Even if you are not a graduate of BSL during the time of Jesus Christ, if you are caring for the sick, you are considered a nurse. Okay. And right now, because of our technological advancement, okay, nurses should be acquainted with the use of computers. Nurses should be acquainted with the use of computers. So, ang tawag ko dyan, kailangan tayo ay global nurse. So when we say global nurse, once we graduated from Our Lady of Fatima University, we can not only work in the Philippines, but we can also work in other countries because we are global nurses. And part of being a global nurse is to be acquainted with technology. So I visited lots of countries already. Every year, I'm visiting the United States siguro mga 2 or 3 times because of my position at Sigma Theta Tau. Okay, and I also visit hospitals. And one of the prominent things that I encounter would be in most hospitals or in all hospitals that I visited. So all nurses are aware on how to use a specific gadget. Kasi for example, kung dito sa Pilipinas, nagjo-duty tayo, magre-regulate tayo ng IV, di ba ginagawa natin yon manually? For example, 30 to 34 drops per minute. So minamanual natin yon. But in other countries, meron kayong machine na ginagamit. Set nyo lang doon, 32 drops per minute or GTTS per minute. So once you click on that, automatic, magre-regulate na yung IV. So kailangan, sa ating mga nurses, dapat magaling kayong gumamit ng technology. Okay, so kailangan global nurse at kailangan ikaw ay nag-heal. So when we say heal, you are a healthcare partner, you are an engaged professional, you are an active researcher, you are a lifelong learner, and of course, you are a servant leader. Okay, so these are what you call global nurses. Okay, question guys. Why do we need technology in nursing? Okay, so let me call on Mark Kelvin. Mark Kelvin, are you here?
Yes, sir.
Okay, Mark Kelvin. Okay, what do you think? Why do we need to use
Ah.
technology in nursing?
Para po mapadali yung trabaho natin.
Very good. Very good answer, Mark Kelvin. So we need technology in nursing because we have 2 reasons. And just like what Mark Kelvin have mentioned, we use IT or information technology for 2 purposes para mas mapadali. Number 1 is automation. Okay, meaning using technology, we use technology as nurses for expediting the way we do things. So for example, I will use technology to save time. So just like for example, what I have mentioned to you earlier, when you are regulating the IV fluid of your client, if you are doing it manually, it will take you around 1 to 2 minutes for you to accurately moderate the IV flow. But if you will be using technology, siguro mga 3 seconds lang, kaya mo na yan. Mabilis na yan. So we use technology in nursing for automation. And number 2, we use also technology for innovation purposes. So meaning, we use technology in nursing to improve the way we do things. And example niyan, I will use technology to guide my decisions. So kung yung automation has something to do with time, yung innovation, it has something to do with quality. So for example, you have nursing research subject right now. So which one is better? A handwritten research paper or a typewritten research paper? Which one?
Typewritten.
Of course, the typewritten research paper. So meaning, if we are using technology to improve the way we do things, ang tawag natin doon ay innovation. Pero kapag gumagamit tayo ng technology, if we are using technology to fast track our usual tasks as nurses, ang tawag natin doon would be automation. So we use technology for 2 purposes. The first one is automation and the second one is innovation. Okay, so there are different types of technologies in nursing. So we have technologies that we are using in nursing education. Okay, so ACEL, ACEL, are you here?
Yes po.
Okay, so ACEL, can you give me an example of technology that is being used in education?
Laptop po.
Very good. So the use of laptops for Zoom sessions is an example of the use of technology in nursing education. How about for Allen Dandan? Allen, can you give another example for the use of technology in education?
Tablet po.
Very good. If you are using tablet, for example, in the clinical area, to jot down your observations for your patient. So that is an example of technology in clinical and in education, of course. How about in the clinical setup? In the clinical setup, maraming machines at maraming technology sa hospital. So, example yon. Kaya, of course, in research, meron din tayong mga websites, meron tayong databases wherein we can get literatures for our research papers. So, ito naman yung applications of technology in research. So, in your examinations, I'm going to give you example of scenarios. Then you're going to tell me what type of technology in nursing is that? Is that technology used in the clinical area? Is that technology used in education? Or is that technology used in research? But of course, magkaka-coordinate yung mga bagay na yan. Okay? So usually when we do research, it informs education and of course our clinical practice. So let's take a look now at the scenario of the Philippines. So let me give you some data. So based from the recent data, based from the recent na yan Okay, so based from the recent data, ito daw yung some of the statistics that are defining Philippines. So and I want to you to focus on the RNs. Okay, so based from the 2013 data, there are 6 registered nurses for every 10,000 population. Okay, so meaning for every 10,000 population, we have 6 nurses. Question, is that adequate or inadequate?
Inadequate.
Inadequate. Very good. So that is inadequate. Why? For example, because of the COVID pandemic right now, if everyone in the Philippines will get the disease, no, the virus, okay, so meaning for 10,000 patients, only 6 nurses can take care of them. So based from the 2013 data, okay, for every 10,000 patients or 10,000 members of the population, there are only 6 nurses. Another one, life expectancy. How many years is the life expectancy? So that is 69 years. So how young are you guys? Tingnan natin. Joanna, how young are you?
21 po.
21. Okay. So based from our statistics, an average Filipino will live up to 69 years. Okay. So ilang years na lang ang natitira? Joanna, ilang years na lang?
40 po.
Okay. So more than 40 years na lang ang natitira if this is the average, no? Okay. And I want you to take a look at the mobile penetration. Mobile. How many percent? How many percent?
107.
107. Yes, so that is 107. What does it mean? So meaning mas maraming mobile phones sa Pilipinas as compared with its residents. Bakit? Okay, so meaning if 100% ang population, 107% ang mobile phones. Okay, do you believe in that? Yes. So 107 ang mobile phones. Okay, so kasi yung ibang mga tao may dobling cellphone. Okay, so ganyan kaganda ang penetration ng mobile phone sa Pilipinas. 'Di ba sabi nga natin, we are the tech capital of Asia, and that is true. And our ICT rank, out of so many countries, we are 98 in terms of our ICT rank. So when we say ICT rank, it has something to do with the progress of technology. It has something to do with, of course, our connection. Okay? And yung net data dito na 36.2%, yung net data dito na 36.2%, it has something to do with the percentage of the population with access to internet. So only 36.2% ang may access sa internet. Okay. Sige nga. So may I call on Kathleen? Kathleen Faye? Kathleen Faye, are you there?
Yes po, sir.
Okay, Kathleen Faye, please complete the phrase. A blank a day keeps the doctors away.
Apple, sir.
Okay, apple. Very good. Blank is the best medicine.
Uh,
Starts with an L.
Laughter, sir.
Very good. Okay, so L pertains to laughter. Laughter is the best medicine. Pero in nursing informatics, good technology managed healthcare is the best medicine. That is according to Dr. DeBakey. So when we say good technology, if you're going to use technology in healthcare, so meaning our healthcare delivery would be better, right? So for example, in advanced countries, gumagamit na sila ng clinical information system that we're going to discuss on one of our meetings. So they're using clinical information system already. So but in the Philippines, okay, we are using paper-based pa rin. So meaning mas magiging maganda ang healthcare if we're going to use technology. Mas nagiging efficient siya. Okay. So what is our subject for this semester? Nursing informatics. And how are we going to define nursing informatics? Okay, so when we say nursing informatics, it is a combination of health and informatics. So that is an amalgamation. So when we say amalgamation, that is a combination. Kumbaga ba, pinagko-combine natin sila. Okay, in nursing informatics, so it is a combination of the previous concepts of health and informatics. So meaning health and informatics combined. So nursing informatics started previously as simply health informatics, and it is a concept or a subject that combines the following variables. And what are those? Computer science, information science, health science, cognitive science, and wisdom. So health informatics is a combination of health and informatics and, of course, encompassing the concepts of computer science, information science, healthcare science, cognitive science, and wisdom. And please listen to this one because this will appear in your prelim examination. Guys, when we say computer science, we are talking about the hardware or the science behind computers. So, para mas madaling intindihin or tandaan, when we say computer science, we are talking about computer hardware. Okay, again, when we say computer science, we are talking about computer hardware. Next, when we talk about information science, we are dealing with softwares, computer software. Okay, can you give me an example of a software? Micaela, Francisco? Micaela, can you give me an example of a software?
May software. Ano
Hindi-
po? Wait lang po. Computer software po ba, sir?
Yes, any software that you are using. Naglalaro ka ba ng ng games sa laptop or kaya sa iyong mobile phone?
Hindi po.
Hindi ka naglalaro?
Hindi po.
Hindi ka naglalaro? Boring naman. De joke. Biro lang, biro lang. Hindi. So meaning hindi ka naglalaro? For example, yung mga games sa cellphone, hindi ka naglalaro during your free time?
Hindi na po.
Hindi na. Oh, pero before naglalaro ka.
Apo.
Yes. Can we consider this as softwares?
Yes po.
Yes. How about the one that you're using to submit documents? For example, prepare mo muna siya sa Microsoft Word. Very good.
Yes po.
Is Microsoft Word considered a software?
Yes po. Tsaka
Yes.
mga Excel.
Very good. Yung Microsoft Office Suite na tinatawag, yung collection ng mga document processing software. Very good. Okay. Very good, Micaela. Okay. So again, computer science is hardware. Information science is software. Health science, ang tawag natin sa health science would be research supporting nursing practice. Okay. Health science refers to research supporting nursing practice. Lahat ng research na nagsusupport sa nursing practice. For example, kapag ikaw ay may lagnat, if you are febrile, okay, what will you do to your client if you are febrile? For example, we have tawag ko nata siya. Ethan, are you there? Ethan?
Yes po, sir.
Okay. So what if, for example, if your patient is febrile? When you say febrile, may sakit, nilalagnat. Okay, anong gagawin mo?
I-assess ko po.
Okay? O mataas ang temperature niya.
Kukuha.
What is your independent nursing intervention for a client with lagnat or febrile?
Tepid sponge bath.
Very good. So, tepid sponge bath or tinatawag nating TSB. Okay. Okay. What is T?
Tepid.
When you say tepid, what does it mean by tepid?
Oh.
When you say tepid, meaning you are saving. Hindi pala. Tipid pala yon. Sorry. Okay. When you say tepid, that is the temperature of the water. Meaning it should be at room temperature. Oh, ngayon lang nalaman yun, ano? When you say tepid, that is the temperature of the water. It should be at room temperature. It should be at room temperature. Not necessarily warm, but it should be at room temperature. Sponge. When you say sponge, that is the one that you're using, right? Bath. When you say bath, you're going to stroke the client, right? Using that sponge. Kaya siya tinawag na tepid sponge bath. Okay. So, SpongeBob sasabihin ko, sorry. Okay. So, tepid sponge bath. Okay. So, based on previous studies, kapag nag-TSB ka in your client, it will lower down the temperature. Is that effective? Yes, that is effective. And that is one of the research that resulted in the improvement of nursing practice. That is what component? Health science. Okay, cognitive science. When we say cognitive science, that is the intelligence of the nurse. So meaning your reasoning nyo. And wisdom. When you say wisdom, it has something to do with ethics, the goodness and badness of human actions. Okay, because in the use of technology, it needs to be integrated with ethics. Okay, so yun yung tinatawag nating wisdom. So when we combine that, ang tawag natin doon ay nursing informatics. And when you say nursing informatics, okay, based from the definition by the American Nurses Association, it refers to the specialty that integrates nursing science, computer science, information science, to manage and communicate data, information, and knowledge in the nursing practice. Or simply, the use of computers in nursing. Okay? So pag sinabi natin, uy, techie yung nurse ah. Uy, techie yung nurse. So saan ka pwedeng mag-work? Sa nursing informatics field. Okay, yun yung konsepto. So before, ito lang ay combination ng computer science, information science, and health science. Pero ngayon, ang tawag natin ngayon, nadagdag na yung dalawa, yung cognitive science and wisdom. Dati, ang elements lang ng nursing informatics ay tatlo. Computer science or hardware, information science or software, and health science or research. Pero as we progress in the new millennium, nagkaroon ng additional two components ang nursing informatics at ang tawag natin doon ay, of course, cognitive science and wisdom. Again, what is cognitive science? Intelligence. What is ethics? Wisdom. What is hardware? Computer science. And what is research? Health science. What is software? Information science. Okay, so let's call on Lance. Lance, are you there? Lance?
Yes, sir.
Okay. So I'm going to mention something, then tell me what component of nursing informatics it is. Okay. Research.
Research, informatics,
Uh,
health
health science. Tama.
science,
Very good. Okay, how about ethics?
ethics, wisdom,
Very good. How about software?
software, wait, wait, um,
Okay, hardware.
hardware,
You have 5 choices only. Computer science, information science, health science, cognitive science, and wisdom. Hardware.
cognitive,
Hardware is computer science.
Computer science.
Okay, very good. Okay, how about intelligence?
Intelligence. Cognitive.
Very good. Ethics.
Ethics. Wisdom.
Research.
Research. Health.
Very good. How about software?
Software. Sir, ano ulit yung choice? Computer. Computer.
Computer science, information science, health science, cognitive, and wisdom.
Information.
Okay,
Science.
very good, Lance. Okay, information science. So in your examination, you already have 5 points, ah. So 5 points na yan.
Yes, sir.
Okay, so right now, I'm exploring a lot about the use of technology in healthcare, no? And one of the things that I'm working on is the use of artificial intelligence. You know artificial intelligence? You know artificial intelligence, guys?
Yes.
No, sir.
Okay,
Sir.
magbigay na
Yes.
example ng artificial intelligence. Do you know Siri?
Yes.
How about Cortana?
Yes, sir.
Okay. So in my pad, I have I have an artificial intelligence machine that I'm using for research, and I'm using this to automate everything in my pad. So for example, I can turn off the lights using this one. Okay, ito yung example ng mga applications ng nursing informatics kasi this is being used in hospitals for patients, no? For patients na for example, hindi sila makakilos, if they want when is the dose of the next medicine, so pwede lang tanungin. And this is one example. For example, Alexa, lights off please. Namatay yung main light. So, ulitin natin. Alexa, lights on. Okay. Alexa, lights blue. Alexa, lights red. Okay. Alexa, lights white. Okay.
I'm not quite sure what went wrong.
Okay. Then we can also ask Alexa regarding everything nursing. Alexa, who is Florence Nightingale?
According to Wikipedia, Florence Nightingale, OM, RRC, DSTJ was an English social reformer, statistician, and the founder of modern nursing. Nightingale came to prominence while serving as a manager and trainer of nurses during the Crimean War, in which she organized care for wounded soldiers.
Alexa, stop. Okay. Alexa, what is the treatment for COVID?
According to First Data Bank, treatment for COVID-19, also known as coronavirus disease, includes rest, fluids, non-prescription drugs such as fever reducers,
Alexa,
use of masks.
Stop. Okay. Alexa, can you sing happy birthday? Alexa?
Okay.
Can you sing happy birthday?
Okay, let's do this. 1, 2, 3. Happy birthday to you.
Alexa, can you please Spotify?
Here's Spotify.
It took me this long.
Alexa, stop. Okay. So that is Alexa. Okay. But there's only one thing that you cannot ask Alexa, and that is to produce your course task. Okay, Alexa daw. Okay, so it's already 2 p.m. So I'm going to remind you guys of your course task. Okay, so as you can see on your announcement, there are 5 things that you need to accomplish. Number 1, independently study week 1 resources. Then after that, after this, I'm going to activate the quizzes. Please take the quizzes. Possible siya na open notes. Okay, number 2, attend synchronous session. So you already attended our synchronous session. Number 3, participate in the discussion board. Guys, on your module, you can see there discussion board. Okay, please respond to my question in the discussion board because that will serve as your attendance for the week. Okay, it means that you are active. Okay, next, answer the multiple choice questions that I'm going to activate after this and submit course tasks at Canvas. So that will be your assignment. So you're going to upload the Word file of your assignment. Okay? And that is due on August 29. But if you can submit it before that, much better. So that you can get your grades for that course task. Again, if you would like to pass this course, I think you need to take course task seriously.